Okay. Well, hi there. I figured I'd come live and talk about how I treat bunions in my practice. My name is Anna Hayoshi. I am a sports medicine acupuncturist and I teach also rehab Pilates in New York City. I see bunion cases fairly frequently in the clinic, so I figured I jump here online. Maybe there are others who would benefit from massage techniques and mobility work and exercises for bunions. And obviously, this is just an informational video, educational purposes only. If you have bunions, if you have pain, it's always best to discuss your care with your healthcare provider, with your doctor. Healthcare works best if it's tailored to your specific needs. You're welcome to do these exercises, techniques, the massage techniques I teach. However, do at your own risk. And if you have pain, stop. Let always pain be your guide. And because if you have pain, that can create inflammation, that can create setbacks. So with that said, in this video, I want to keep it for 15, 20, 25 minutes if there are any questions. And so I'm going to go over basic education as to why bunions form. Next, I will teach the massage techniques, manual therapy techniques I teach to my patients and I use in the clinic. And lastly, the exercises that I send my patients home with. So why do bunions form? A very brief introductions. Bunions can form for a variety of reasons. Number one, it can be hereditary, meaning that it passed down in families. More females tend to have bunions as opposed to males. The reason for that is because females tend to wear tight-fitting shoes or high heels that can predispose them for forming of a bunion. Second reason can be because of some sort of weakness. Either the foot is pronated, means that the foot is turned in, and that forces the big toe over the second toe, either under, pushes the toe away, or over the second toe. Ankle weakness, pronation can lead to formation of bunion, but also weakness higher up the chain. So frequently we see hip weakness leading to bunion, or even core weakness leading to hip weakness, leading to pronation and the formation of bunions. Most frequently prescribed treatment for bunions is pain medications or surgery. In general, I'm not against surgery, but when it comes to bunions, bunion surgery is very painful. And I believe that if the underlying cause is not corrected, then either the bunion will reform after the surgery over time, or if not a bunion forms because of the weakness, because of this unfixed underlying cause, there will be some sort of other imbalance either in the foot or higher up the chain. So that is the educational part that I wanted to share. And for next, I want to teach the techniques, the massage techniques I teach my patients. And for that, you need some sort of a lubricant. What I like to use in the clinic is, in my office, is this ointment called UI oil. This is a herbal oil. The herbs in this formula help with pain, reducing pain, help reducing swelling, help reducing inflammation. So this is from a Chinese herbal pharmacy downtown in New York City. I'm not sponsored by them, so I don't get paid for promoting this product. I believe it works really well. So the way I massage the foot for bunion issues is I pour some lubricant into my hand. Make sure that I put a lid back on before it spills everywhere. And then anytime I massage an injury or a body part, an area where there's pain, I start away from the pain. Meaning bunion is on the first ray, the big toe. So I start massaging the pinky toe, the tissue between the fifth and fourth toes, the fifth and fourth metatarsals. Most people have tight feet anyways to begin with. So massaging the foot actually feels really good. So just massage between the fifth and fourth toes, and then over time, in a couple minutes, make your way up to the fourth and third toes, the third and second toes, and then lastly, between the second and first toes. Bunions have a tendency to move towards the second toe. So the tissue here is usually very, very stiff and tight. So the goal here is to have the ability to dig in there and then break up this stiff, thick tissue to have a flexible foot, to have a supple foot, to have a mobile foot that is easier to strengthen. Breaking up the tissue also brings the healing cells of blood flow, nutrients, oxygen, and carries away the waste products. And then after massaging the top of the foot for a couple minutes, I venture on to massaging the bottom of the foot. So here too, start away from the pain, massage by the pinky, and then the fourth, the third, and then lastly between the big toe and the second toe. Just to break away the stiffness, just to improve mobility, improve flexibility in the joint. So you can also bring your fingers between the toes. This feels good. Just to mobilize the tissue and loosen up the tissue. Once I'm done with this, what I do is manually mobilize the big toe. So it has the tendency, the big toe has a tendency to lean towards the second toe. So you want to move away from, break it away from its tendency to be stuck. So you can put your thumb on the joint and then move the big toe away from where it's stuck. And obviously I don't have a bunion, but someone who has one, the joint is usually not as mobile as mine. Let pain be the guide, but try to lift the toe away. You can also push the toe down and try to push the toe up. The goal is to break up this calcified, thick tissue. And so after a couple minutes of mobilizing the big toe, moving it away, moving it down, and moving it upwards, I'm done with the massage. I'm done with the mobility work, the manual therapy. And so I usually clean my hands with a paper towel. And then the next part is the exercise. I usually give my patients a yoga toes or toe corrector. I got this from Amazon. Again, I don't get paid for talking about this product, but I'm going to link it in the description. And if you want, you can purchase yourself. So wearing the yoga toes is important and is beneficial, but someone who has a tight foot, initially they may not be able to wear it for a long periods of time. So wear it for 5-10 minutes, and as your foot softens, becomes more flexible, you will be able to wear it for longer periods of time. So the exercises that I teach my patients with bunions wearing the toe corrector is, the first one is just simply pointing and flexing the ankle. Pointing the foot brings the foot into plantar flexion, and then flexing the foot, bring the foot into dorsiflexion, bringing the toe closer to the nose. With this movement, feels good. You're mobilizing the ankle joint, but also the muscles in the top of the foot actually originate in the lower limb. The muscles of the bottom of the foot, some of it originates in the back of the calf. So not only are you mobilizing the ankle joint, but you're also loosening up the muscles in the lower limb as well. So just point and flex the ankle for a couple minutes. And then the next exercise is drawing some small circles with the foot. With this too is mobilizing the ankle joint, loosening the tissue, and loosening the muscles in the lower limb. Next, building on this is moving this down. Learning to curl the toes under. So with that is starting to strengthen the bottom of the foot, strengthening the arch, creating what we call a short foot. So curl the toes under. What you have to pay attention here is that you don't let your feet to flare out or turn in. Try to keep the foot tracking properly. And then just scoop the toes under. Again, do this for a couple of minutes, and then building on this, the next exercise is when we're bringing the toes closer to the nose. So here, lifting the toes up. With this, again, just mobilizing the toe and also mobilizing, strengthening the muscles in the lower leg. And then the most important exercise, the same thing with when I massage. Lastly, the last is when I'm actually touching the affected joint. Same thing goes for the exercises as well. Lifting and lowering the heel, calf raise, because that actually can put strain on the joint, so that can be painful and uncomfortable for some patients. The goal here is to lift and lower. The goal here is not to flare out or flare in, but track properly. And just do 10 calf raises. The more often you do the massage, the more often you do the exercises and the manual therapy, the sooner you will see results. The most important exercise is the ability to learn to spread the toes. So this is hard for some people. It took me 4 weeks till my big toe was able to abduct, meaning to move out away from my foot. If the toe is stuck, you can help with your finger and try to mobilize it into the area which way you want it to move. So spread the toes and curl under, and spread the toes and curl under. It's a very important skill. With this, you stretching the foot and also strengthening the muscles in the foot. So these were the exercises that I wanted to teach. These are the exercises that I teach my patients. And so another product that I use is this pain patch. This is called 701 plaster. So majority of the pain patches that are available on the market over the counter contain only menthol, methyl salicylate, and camphor. This pain patch contains all three, plus it has herbs in it that have pain, swelling, and inflammation relieving properties. So it can actually not only distract only your nervous system, but actually has ingredients in it that can help promote healing. I will leave the link for this one as well in the description. This is a large, long pain patch. So after the exercises, if you have pain, you just cut off a piece and then you put it on the joint. So it helps to promote healing, helps to decrease pain, and more importantly, it helps to decrease the risk of inflammation after the manual therapy or after the mobility work or after the exercises. And that's all I wanted to share. If there is any questions, please leave it in the comments. Or if you have any suggestions for a further topic, I'm happy to come live once every 2 weeks, once a week, once a month, and go over various cases, discuss various cases if there's an interest. Leave that also in the comments. And that's all I wanted to share for today. I hope you find this video useful, and thank you so much for joining and watching.